Hi all, welcome to Oet Speaking and Writing. Today we can discuss an Oet Roleplay. Here, this setting is a community health center. A 35-year-old man has come with mouth ulcers. These are giving him a lot of trouble. The patient is irritated and wants to get rid of it. Task: collect history, reassure the patient, explain the cause of his problem, advise about dietary restrictions, explain about the treatment plan. Here, this setting is a community health center. So the patient is unknown to you. So no need to ask the name during your preparation time. Here, you can start your conversation by saying, "Good morning, please be seated. My name is Sarah. I'm one of the registered nurses working in this community health center. How may I address you?" Let's assume the name is Mr. John. Then you can ask him like, "Okay, Mr. John, tell me what brings you here today?" Probably the patient may tell you like, "Sister, I'm really concerned because I have multiple white laceration in my mouth and these are giving me a lot of trouble." At that time, we need to reassure the patient. We can say him like, "Mr. John, I do really understand that it is quite difficult for you. I'm sorry to hear that. Mr. John, these mouth ulcers are very common condition among many people. Try not to worry. I'm here to help you." Then, as per our first task, we need to collect the history from the patient. So you can ask question like, "Before proceeding further, can I ask you something related to your condition?" Probably the patient may give you permission to ask questions. Then, after getting permission from the patient, you can ask questions like, "When did you first notice the lesion?" Then you can ask, "How frequently are you getting these lesions?" Next question will be, "Have you noticed any change in the color of the ulcers?" Then you can ask, "Mr. John, is it painful? Do you have any other medical condition?" Then you can ask, "Are you on any medication? Do you have any habits like smoking or drinking?" These questions you can ask one by one. In this way, you can collect the history from the patient. Then you can tell him like, "Thank you for giving me the information. Can I examine your ulcers?" In this way, you can ask permission and you can just assess the ulcers. After 1 second, you can continue by saying, "Mr. John, from my assessment, I suspect you have some inflammation and ulceration on your oral mucosa. Don't worry about that. It can be treatable and curable." Sometimes patient may ask you about the cause of these ulcers. If he doesn't ask about the cause, you can ask question like, "Do you have any idea about the cause of these ulcers?" And as per our task, we need to explain about the cause. So you can say like, "Mr. John, I'm glad to explain it to you so that you can avoid the cause. It might be because of an accidental biting injury while brushing teeth, poor oral hygiene. Sometimes it may be due to irritation from strong antibiotic or antiseptic cream or mouthwash." Is that clear? It might be because of an accidental biting injury while brushing teeth, poor oral hygiene, irritation from strong antiseptic like mouthwash. These are some of the reasons for these ulcers. Are you following me? Then sometimes the patient may ask you the treatment. So you can explain him like, "Mr. John, I would like to explain about the management of these mouth ulcers. Shall I explain to you?" Then you can explain like, "There are few things that you can follow in order to prevent mouth ulcers, such as brushing the teeth gently. Use soft brush for brushing and do it gently. It's really important to maintain good oral hygiene. It would be better if you could follow a well-balanced diet and drink plenty of water. Along that you need to avoid spicy food until the ulcer heal and regularly rinse your mouth with warm salty water. Is that okay? You can also tell him like the doctor will provide you with some antiseptic gel and pain relieving medication. Is that okay? Then you can ask, do you have any other concerns? If there is no concerns, you can reassure him by saying, I assure you that if you follow this suggestion, you will get a speedy recovery. Then you can wind up by saying, I hope I have cleared all your concerns. Thank you for listening to me. If you need any more help, just call me at this number. This is my number. I'll be available here at any time. Thank you, Mr. John. I wish you a speedy recovery. In this way, you can wind up your conversation. Thank you.